There is no doubt that now we are realizing that COVID-19 is indeed the single most significant crisis since World War II and will be a defining event globally. One of the key outcomes of COVID-19 has been the notion of social distancing, which also resulted in restricted mobility and border closures. All of this had significant economic downturns, which have affected quite disproportionately vulnerable or low socioeconomic status communities. We see this in particular in terms of impact on indigenous communities, impact on temporary workers, asylum seekers, refugees, international students, and many other non-citizens. COVID-19 has also amplified a number of existing social inequalities, in particular as we see it in relation to education. The global community had to move almost 1.5 billion children to learn remotely from home. This is not an easy task, and one of the key challenges, of course, is that it amplified existing digital disparities between what we call the global north and the global south, in particular in regions such as sub-Saharan Africa. Furthermore, I think we've seen, unfortunately, renewed or emergence of new forms of ethno-cultural racism against Asian peoples and communities, in particular in emigre and multicultural societies. A lot of these are obviously very negative outcomes of COVID-19, but paradoxically, we have also seen some positive trends. Trends that include, for instance, the emergence of new forms of online solidarity, cross-cultural engagement. We see neighborhood apps that have been developed to look after the elderly, to provide shopping supplies for the disabled, and many other examples. We've also seen the emergence of new forms of transnational solidarity, what I refer to as the medical diplomacy. A number of countries, including China, India, Cuba, and others, have been sending medical equipment, medical expertise, medication, etc., to neighboring countries and even countries far away from their own location. This really highlights the deeply interconnected and interdependent nature of our world, and this surely must be part of the post-COVID-19 world order. We know that as a pandemic, COVID-19 is affecting all aspects of our social life, and therefore it requires evidence and knowledge from multiple academic disciplines in order to understand what works best under what specific local conditions. We acknowledge that COVID-19 is primarily a public epidemic health challenge, but epidemics are also at once social as well as biological phenomena. Therefore, the challenge of responding optimally to COVID-19 will require insights from humanities and social science research expertise if it is to be contained and ultimately eliminated quite effectively. Our humanities and social science research is critical in such crises because it allows us to provide holistic, contextualized, and deeply ingrained understanding of how different cultural systems approach and respond to public health crises. In terms of adaptive strategies, in terms of collective responses, in terms of communicative preferences, for instance, and overall societal adjustment to new restrictions on contact, networking, etc. Humanities and social science research is also critical for fighting against what the United Nations Secretary General recently labeled misinfodemic. That is the use of social media and online platforms to spread false information, conspiracy theories about the pandemic in ways that undermine global efforts to contain the disease. Our history has shown us that, like all pandemics, COVID-19 will ultimately be suppressed, if not eliminated. And that means that there will be a world post-COVID-19. One of the first key things that we need to think about is a more equitable, sustainable development across the globe. Intercultural dialogue here is very important because of its deliberative potential in discussing, negotiating, and committing to a shared and mutually binding global development agenda. We also would expect that there will be a more inclusive, convivial societies that emerge post-COVID-19. Again, here, intercultural dialogue is critical because of its emphasis on mutuality, exchange, respect, and transformative change. Additionally, we will need for our post-COVID-19 communities to be more creative and more resilient. And here, what we mean by resilience is that they are able to adapt and respond at times of crisis. And intercultural dialogue here will be essential for negotiating the new socio-political contracts that are locally empowering, but also will allow for creatively co-designing these new development agendas. And these new agendas will have to be premised on more sustainable and equitable access to resources. Ultimately, post-COVID-19 global world order will be shaped by core values, core principles that will allow the international community to move in ways that reflect the deep interconnected, the deep interdependent nature of the global village within which we live today.